I'm Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we're going to talk about what to do if you wake up with a stiff lower back. So this is a really common issue people have, and people talk about it in different ways. Oh, I wake up and I'm just sore. I wake up and I'm stiff. I wake up and I don't move really well. This is really a big warning sign that there's lower back issues going on. So you want to kind of heed this warning, especially if it's something that happens on a regular basis. Now, if it's something where you're traveling and you're staying in a different bed and you wake up and you're like, oh, I'm just a little stiff, that's kind of normal and to be expected. Should go away within 2 weeks. If it doesn't, then that's an indication of a problem. But if you're someone who consistently wakes up with stiffness or soreness, that's not normal, and you really want to make sure that you do something about it, because that can develop into something much, much more than just a stiffness or a soreness when you get out of bed. So here's a couple of things that you're going to be able to do, and I'm going to be talking a little bit in the laying down position, so I want to go through a few things first. Generally, stiffness or soreness in the morning is just more of a muscle issue. You want to make sure that if you have numbness and tingling going down your legs when you wake up, that you get that checked out. That's a little bit more serious of an issue and is something to be concerned about. Also, it's to be noted that low back pain is not hereditary, as many people think, and the low back stiffness is not hereditary. So just because your mom or dad had a hard time getting out of bed in the morning doesn't mean that you are subjected to that. So, you want to kind of pay attention to those things, because I know people are easy to kind of brush it off as either a hereditary thing or something that's really out of their control, when a lot of times it is perfectly in their control. So, and the final thing I want to talk about before I tell you what to do is look at your mattress. Either flip it, change it, buy a new one. It's really important that you make sure that you have a good mattress, and that mattress is not 10, 15 years old and it's not worn, and you don't take the sheets off and there's a divot where you sleep. That's time for another mattress, time to rotate it, time to flip it, whatever the case may be. So, and I know people, balk at the higher price mattresses, and believe me, it's on my wish list. I don't have one yet, but they are really good, and they are really worth the money if you're looking at spending money on a new mattress. Otherwise, you want to make sure that you have a semi-firm mattress. You don't have to sleep on a board, but you don't want to have a really soft pillow top mattress. You want to get more of a firmer mattress that's going to support all areas of your body. When you lay down on it, you should not feel anywhere where you're dropping or anywhere that's uncomfortable. So when you wake up in the morning with a stiff back, a lot of times you're going to roll over onto your side, and you're going to be, a lot of times when you're with a stiff back, you want to bring your knees up first. That always feels generally pretty good. What you can do is when you wake up, and if you feel like, oh, all right, I got to roll over, and you feel like you're 90 years old, but you're not, you can start by just bringing one knee up to your chest. Now, a lot of times if you're stiff in the morning, you're not going to be able to bring this all the way up. It's not going to come maybe more than past here. You don't have to apply a lot of pressure to it. You don't have to put a lot of pressure into it. You just want to gently pull. Now, even lifting your leg up is tough. You can grab from behind your leg and give some assistance that way, where you're just moving your leg up and down. This is going to help open up some of those muscles in your back and in your hip that tend to get sore when you're sleeping. Another thing that can cause you to have a stiff back when you wake up is your sleeping position. So if you find you have a good mattress, but you can't seem to wake up and not have a stiff back, you want to see how you're sleeping. If you're sleeping on your back, you want to have a pillow underneath your knees. And a lot of times what happens is I tell people to do this, and they wind up putting this pillow down, and then they go to sleep, and you almost wind up with a flat pillow, or a flat pillow, because the weight of your legs will actually cause that pillow to compress downwards. What you can do is actually roll your pillow up. You want your knees about as high as you can get them, and then you can do this. This is going to bring your low back into the mattress, which is going to help you to be able to sleep on your back and have your knees, and have your back not arched like this. Now, that's a gross exaggeration of what laying on your back looks like, but you do wind up with your pelvis pulled forward. You do wind up with an arch in your back, so you want to make sure that you are having those knees elevated. If you sleep on your side, you want to be careful because you want to make sure that there is a pillow in between your knees and there is a pillow in between or on your side if you wind up having, if you wind up sleeping and you're like this, okay? So your side actually drops down. More common in women with wider hips, your side will actually drop down into the mattress. Most of the time you won't get low back stiffness, you'll get actually pain just on one side of your low back. So be careful of those things. So first thing you can do, like I just showed you, is you can just do your gentle leg pulls. Okay, then what you can do is one at a time and then bring them both up, all right? A lot of times if you're stiff or sore in the morning, you're not going to be able to bring them up on their own, okay? So you want to bring one up and then the other. And then again, gentle pull. You're probably not going to get it all the way that you normally could if you were at the end of your day and you were all nice and loose. You want to do that just a couple times. These are exercises that are not designed to give you a good stretch. These are exercises that are not really designed to be done for certain periods of time. This is just allowing you to loosen up. If you get out of bed and you're not loose, you're going to wind up pulling something, maybe even tearing something, possibly herniating a disc because your muscles are like this. So you want to give your body a chance to wake up a little bit and be able to move. The next thing you can do is you want to just cross your ankle over your knee, okay, and just sit like this. A lot of times people will like to pull this towards their chest. Perfectly fine if you're able to do that. Sometimes people are just too stiff and crossing their leg over their knee is enough. If you can pull it up, great. It's going to help you loosen up a lot more. The one exercise that people like to do, and I go back and forth on recommending this, honestly, I don't recommend it for some people swear by it, is the rocking of the knee. So a lot of times people tell me, oh, this really helps them loosen up in the morning. I'm okay with a gentle rock, okay, back and forth just like this. When you get down here and you get down here, you wind up really working your back muscles in order to be able to pull your legs up. So you want to be careful. This right here will help loosen your back up, nice and slow. This right here, where you're dropping your legs to the side really far, will wind up pulling your back, will wind up making it much worse than what it is. So those are a couple of things that you want to do if you wake up and your back is stiff. If your back is stiff for more than 2 weeks, that's a sign of a problem. I promise you, it will not just stay at low back stiffness in the morning. It's going to progress to something much more severe, much worse, and it's much easier to treat when it's actually just low back stiffness in the morning. And there's no amount of Advil and there's no amount of ice that's going to take care of a low back stiffness problem in the morning, especially if it's been going on for months, years down the pike.